Just nobody told us about it until.
Welcome, everybody. Let's call our meeting to order today, and we'll start with a roll call.
Kim Fisher.
Here.
Susan Fowler. Ann Robin.
Here.
Neil Sharma.
Here.
Vicki Nicewander.
Here. Hooray. We have all of us here today and a nice full crowd in the audience. This is a really exciting time, so welcome. Let's go ahead and do the approval of the agenda, which is on page 1.
So moved.
Ann moves. Second from, yes, okay. All right, and all in favor say aye.
Aye.
Aye. Okay. All right. Motion carries. We'll go on to citizen input. Do we have some of that? Nothing. Okay. Anybody on, are there people on Zoom that might want to speak to us?
No.
Nobody wants. Okay. All right. I'm going to forego my comments today and we'll move on with the agenda because it's pretty full. Executive Director report.
I think I should do the same. Thank you.
All right, we're going to go ahead and get started with our review of applications for fiscal year 2026. I know the board has been working really hard reading and reviewing and generating questions for the proposers. So I think that we're going to focus strictly on the questions that you have today and keep things moving as much as possible. We'd like to get this done in the time allotted. So we'll just start with the first one, I guess, and that would be me. Well, it's the proposal that I'm looking at is the Champaign County Regional Planning Commission, the community services thing. This is will be the second year of this proposal. Do we have somebody from? Yes. Come on up.
I think it's a couple more than.
Is it more than 2?
It's evolved over several years. Do you want to speak to that, Kim?
Yes, it's at several years. It started as just something a little bit smaller and has evolved, and now it covers many different things.
Yes.
So
Yeah, it's the person-centered, it's the discovery process. This is the one that's the discovery
yes,
process.
Angela just said she believes it started in 2018. I think that's correct because I worked a little bit on that application before I got a new job.
So questions for Angela on this proposal? Nothing? You're getting off easy. So tell us a little bit about the maybe the most exciting thing that's happened.
I think just being able to, with the transition from not doing state funding and being able to focus solely on county funded individuals, getting back to being able to really spend time with the individuals that we're serving, getting to see the quarterly visits through, being able to spend time developing their plans. We're now starting to talk about how can we maybe add another component to the person-centered planning process to, keep doing the state side of things. Mm-hmm. So we don't want to, confuse providers by throwing something completely different out there when they're already getting something from the ISCs, but developing something maybe small that is more understandable for the individuals that we're working with, but that maybe they can take more ownership over and understand better. So just being able to really focus more on that program, at least for me, because the state side of things was so time consuming. So now I have the time to really look at that and look at how we can truly evolve this into being truly more person-centered.
I'm interested, you said you've thought about adding to the person-centered planning process, and I think that's really smart because I'm not a real fan
Mhm.
of the process as it exists. What have you changed in it?
We haven't necessarily changed anything yet. I wanted time to be able to talk it through with the team and try to figure out, and time to kind of work it out to make sure that what we do implement works well. I feel like we'll continue the same discovery process. I don't necessarily want to add to that. I don't want to make it more daunting for the individuals, because I think that process does take time. It's a lot of questions. But right now, what we've been talking about is maybe, working with the individual to pull out some of those key pieces in the plan that are most important to them, and maybe putting them, even if it's just on like a one-page flyer, something with pictures, and the most important things about them from their perspective that they can like have, copies of, they can hand them out to people that, and it's things that they can truly talk about themselves and, take pride in, because right now they have the plan, and we certainly go over with them, but it's, it's very wordy, and I don't think that they really, when in the scheme of things, really probably understand everything that's in it.
Yeah, I would agree with that. I think that's a great idea. Dan, do you have any comments or questions? Anybody else have a question?
I just wanted to reiterate how important it is to fill this gap, because she could be waiting on the PUNS list still for years.
Mm-hmm.
And as a parent who was on it for 7 years waiting, I love the fact that there's interim services, even if they're minimal, so that people aren't forgotten and they can begin working
Yeah,
on their concerns.
agreed. Thank you very much, Angela.
Thank you.
And next up, we have the autism program, who is the lead person on that? Oh, service coordination, you're right. Okay. Kim Fisher, okay.
Okay, so this grant is for DSC's Program Service Coordination Program. They are requesting $500,000, which is a decrease by 4% for this program. This program helps people develop their service plans, link participants to many different types of benefits, helps them with taxes, guardianship, etc. They had mentioned that they are going to they currently are servicing about 250 or 257 people, and they're going to increase it to 275. There was a question that staff mentioned that I just wanted to address, if somebody from the program can come up. Thank you. Okay, so one of the questions that staff had was around wait time. So they wanted to know the percent of people who are reviewed and are denied, and what kind of, you might not know what happens to them afterwards. Can you maybe address that piece?
Hold on. This has to be read? That seems wrong. Okay. For case management service coordination, typically we don't get too many referrals just for that. Typically people are coming in for another program and then automatically will receive that. So if they are asking for that, there might be, a 4 to 6 week wait. We get a lot of SDA referrals for the home-based support services from the state side. And then it's just making sure, I'm decently staffed at that moment and we can get the ball rolling. As far as denial, there really isn't anyone necessarily denied. They're either referred on to maybe more appropriate services. they don't really meet the criteria to come here. Or, doors might be a referral. So I don't feel like we have too many that we out and outright deny.
And do you have a wait list for folks that are?
Not specifically for case management service coordination, but for other programs we do.
Okay, great. I'm going to direct this to Chris real quick, if he can just clarify, and then maybe you all can answer. So in the budget discussion, and this is through many of the programs for DSC, there is a agency surplus of $226,000, $363. And then this program has a deficit of $2,887. And while our budget is balanced, I think there was some messaging about could that surplus maybe address some of the program deficits. And so Chris, am I accurately capturing that?
Yeah. Yeah, that was just the question that we had. If the agency's running a surplus, then if the program's running a deficit, why don't we shore that up?
Okay, great. So maybe you all.
Well, I do know our CEO and CFO are looking into that and have sent an email and are working on a response to that.
Great. So I guess just as we proceed, maybe addressing that before the delivery of the funds would be great.
Yes.
I just want to highlight that the cultural and linguistic competence section, like you all are just overall DSC. I keep saying DFSC because that's a committee in my job that I apologize. Just that you're really investing in your staff with the retention. So that was really great to see. Whether it's employee assistance and training and things like that. So that's, I think, let me just double check. Those are all the questions that I had. Susan?
Well, again, this is a really important program, and without case management and service coordination, people end up lost. So, I'm very favorably disposed towards it. Okay, I was on. Okay. But I've got a couple of questions. One question, which again applies to many of the other grants that have been submitted, is it just seems like a lot of money has to be requested. Well, it's proportional to the budget, but for infrastructure supports. And I don't know that, I'm not asking you to defend that or at this time, but it seems like we need to do something so that you don't have to pay 1% of a person's salary in order to have accounting or maintenance. And I just want, I guess, the staff and the board and the agencies to think about, is there a better way than doing that? You don't have to answer today, but in the long run. And if you think it's the best way to do it, I'll shut up. No, really.
Is it okay for me?
Yeah.
So with larger agencies, and DSC is not the largest agency funded by between the two boards, Mental Health Board and DD Board, there are lots of different ways to represent the management and general piece. And I know this is extremely complicated looking, but to me, it's easier to understand than some of the other methods. But there really are other methods. And if you're saying you would encourage the agency to try it a different way, it might be easier for them too. And Chris may have an opinion, but I've always find it interesting.
Yeah, we had a conversation about this time last year with DSC about their budgeting, and we came to the consensus that this is appropriate and acceptable. So
Okay.
It's really complicated looking, but
It is. So I'll withdraw that. I just, I'm hearing about indirect costs being cut at the university by the government, and somehow I'm used to indirect costs as a way of just covering some of those necessary infrastructure, but I'm not going to impose a system I've lived under on anybody else. It was more of a by the way, because you go through many, many pages of staff who are 1% for infrastructure. More pertinent to actually what you do with the program, I was curious, and it may be important in the future as funding potentially gets tighter. We don't really know what the landscape will hold. But since 91% of the cost is for personnel, having information about staff retention or turnover could be really interesting. So, what is the caseload for the typical QIDP? I know that the staff, you have approximately 7 full-time staff as QIDP, and yet you're serving, a large number of people. And if you have turnover, does that, what's the wait time to replace? Again, that doesn't impact your request for funds. It's just that as you think about the future applications, you may want to very strongly state what some of the challenges are that you're addressing and how you're addressing them when you're asking for the funding.
Yeah, the wait time to fill the position has been very variable. I feel like we've always kind of suffered a loss of at least one position.
Yeah.
The criteria that you have to be qualified as a Q on the state level to sign off on things is a pretty narrow bachelor's degree and 1 year's experience, which I think makes it challenging because we probably have a lot of great people that could be a Q that don't qualify. But irregardless, if we're short-staffed, we're still covering the entire, everybody we serve that has case management. So caseloads can vary. I would say they're probably in the 50s, generally speaking, because we're usually kind of helping coverage. And then when a new person comes, there's a pretty big learning curve, and we're not getting quite the experience coming. So there's a lot to know for case management. So I feel like we're working together with the new people for quite a while.
You turned your mic off.
I'm just thinking of ways to strengthen in the future, not now. And then my other question, which again is maybe more future oriented, since these are lifelong services, you have clients for 50 years, I assume, 40 years, 30 years or longer. How many new slots open each year for people who are waiting to get into service coordination?
Well, the other programs all have to have openings. So whether I want to or not, we're going to have openings. I mean, we still have to serve people. We have to find a way to get new people in. I mean, we're still trying to get probably at least 8 to 10 people in a quarter. So, I mean, every once in a while, you'll have somebody leave for this reason or another if they move out of the county, go to a different SILA, or unfortunately, some people pass away, move on to nursing homes. So,
but if someone were to move into the county from another location, maybe to be closer to family, how long might it be for them to be able to access case coordination or the service coordination? I know they have to get into a program, but
well, it could still be pretty fast if they have the need. I think unfortunately some families probably don't even know they have the need for case management until they start another program and we start kind of peeling the onion, and then they realize maybe the assistance we can provide, and we find out the issues they're having, because I feel like unfortunately families are just trying to live day to day and don't even realize the assistance they need and the questions they have. So I think that's why we also don't get maybe too many just case management referrals. They're wanting more than that and not realizing the help they could receive just from case management.
Again, I think it would be a very good sell, so to speak, in the future if you could talk about those who are waiting, because right now it just seems like it's a very smooth process. Everybody gets served, but I know people do come and go.
Yes.
Unfortunately die.
Yes.
And so again, not for this application, but for the future, I would maybe spend a paragraph or two on how you accommodate, or the pressures of accommodating new people. Thanks so much.
Thank you.
It's a very important proposal.
Thanks.
Any other questions? Thank you very much. Okay, now the Autism Project, right? That's where we are, and that is Susan.
Yes. So this proposal requests $87,000 roughly, 65% is personnel. It's an expansion of TAP to a new area, and the new area proposes group sessions or social programs that are of varying length for middle school students and elementary school students. And these group sessions for improving social skills interactions are self-referral and self-identification. Is that correct? Okay. And then it's also proposing the use of environmental assessments and interviews to help people with autism who are having difficulty adjusting school, work, community. As a parent of a young man with autism, I can very much relate to that. And then it, plans to take advantage of the TAP Resource Center for those who come in. So I think all of those are important, but I'm a little concerned about the inclusion criteria because we have been limited to those individuals who are likely PUNS qualified or waiting to move on to the PUNS list. And the inclusion criteria for this new program doesn't require any kind of formal diagnosis, but rather self-identification of neurodiversity, which is, pretty broad. And I'm wondering if the board should be looking at expanding the populations that it funds services for. And if we do it for one program, what does that necessarily set as a precedent for other programs? So that's a question for staff too.
You would start with the funding requirements and guidelines document. That's where your eligibility criteria are defined. And traditionally, they've been defined exactly by what the state was doing because only a couple of years ago did you gain the authority to change that. And the discussions that we had and that was a few years ago, but the discussions were, we already have so many people who are fully qualified under the state's criteria for IDD who are waiting for so long for critically important services that expanding the eligibility criteria at this time could be difficult for, and then the further issue, because we watch what the state does with eligibility criteria too, a further issue is that you can reach more people if they have fewer support needs. So another problem unique to this community is it's difficult to find services for people with very complicated support needs. So it was so you haven't had the opportunity to have that discussion as a group, because this is a few years ago, but you can change your eligibility criteria at the time of revising those funding guidelines, or you could do it in the priorities setting that you do annually, and that would override what the eligibility criteria say in the funding guidelines. But it has seemed to me not to raise the question to you because we're still in a community where a lot of people are not receiving the services they need and they're fully qualified.
Well, knowing that then, I'm very, although I think it's a wonderful idea, and I certainly would have loved to have been a participant in those services for a member of my family, I'm just reluctant to say we should expand to a new service program until we know what the funding landscape looks like. Then I had a couple of other recommendations. If it were funded, I think that the outcomes could be more measurable than those that were proposed. 90% clients utilize the option and are satisfied. I think it's really important to know exactly how many people utilize the option and then to have the satisfaction. I think it's probably also very important to know the number of environmental assessments that are conducted and if the proposed changes are supported. If they're not supported, then it's a frustrating cycle for the participant. And finally, the extent to which public schools for elementary and middle school students already support some of these issues. Because according to IDEA, they should. That doesn't mean it happens. So I'm sure that you brought this proposal forward because of a clearly unmet need. And I applaud that. I really do. I'm just concerned with the funding landscape. And I don't mean to curb your enthusiasm at all, but as a board member, I have to think about the larger picture.
Yeah.
Okay. My co-reviewer was, oh, yeah, Neil, sorry.
Yeah, no, I share a lot of those, the same concerns about like about the self-determination. And from your experience, what is the barrier to actually getting people assessed or getting a proper diagnosis?
Yeah, actually, thank you. That's actually our biggest concern, and reason why we are keeping it to more open to self-diagnosis, because there's actually a lot of barriers to receiving the diagnosis, a lot of systemic barriers actually. There's gender bias in the diagnosis themselves. There's really long wait lists for the diagnosis. Currently, it's between 8 months to a year just to get the diagnosis. There's also, excuse me, I lost my note. Okay.
Insurance costs?
Yes, the costs are definitely a barrier. I apologize. The diagnostic criteria was based around white men, lack of access to informed providers, just overall significant systemic barriers to accessing a diagnosis.
Is it in the sense like people aren't able to get like neuropsych testing?
Mm-hmm.
Okay.
Yes. Mm-hmm.
Okay.
And that neuropsych testing is typically what is required for a person who is diagnosed with autism to receive any sort of services, especially through the state.
In terms of like, what would you say is your percentage of people with the self-determination and sort of like the costs associated?
I think it would be hard for us to estimate that because we don't require a diagnosis.
Can you speak into the microphone?
Sorry, I think right now it would be difficult for us to determine that number because we aren't currently requesting that information. We are understanding that and have always, as an organization, understood that there are significant systemic barriers to receiving a diagnosis of autism. So we really couldn't necessarily say, even right now, what percentage of people that we see receive a formal diagnosis versus a self-diagnosis or, a mental health diagnosis or on a waiting list, because we'll serve anyone who feels that they need services for any sort of autistic trait.
Yeah.
And we don't charge for any of our services. They're all for free. So
Into the microphone,
I'm
please.
sorry, we don't charge for any of our.
Turn it on.
Oh, I guess okay, one at a time. I'm sorry. Yeah, we don't charge for any of our services. They're all for free. So we don't require a proof of a diagnosis to provide those services because of the systemic barriers to getting it.
I think I'd also like to add that this is a population of children who are in the process of figuring out why these children are not succeeding in school. Part of the programming that we're proposing is environmental assessments, and to address what you were saying about the school systems being able to meet those needs. They're not. They're hungry for support from the community because they themselves don't have the resources. So we're looking at children who are developing and providers who don't understand what autism is. And so parents are concerned bringing children to the doctor, and they're saying, let's wait another 6 months. Let's wait another 6 months. Meantime, they're at school with behavioral disruptions and classroom disruptions and really negative behaviors that are affecting their self-concept. And what we're seeing, we have the benefit of seeing very small children all the way into adulthood, and the ones who are achieving the greatest things in adulthood or having the least amount of support needs are the ones who received the services early on. So it's a conundrum that I completely understand, but it's the state of autism, and autism just doesn't fit neatly into these classifications. And so I think it's whether you're going to take it on or not,
Yeah.
There is actually a statutory barrier that has not been removed, and that is this board this fund can't be used for anything that would be covered under the school code Article 14. So even if the schools aren't doing it, and we've been in this position before with school districts writing letters saying, oh, it's okay if you want to fund it because we're not doing it. But that doesn't change the DD board's authority. So that maybe calls for, maybe the state needs to revise the statute to lift that limitation. But we do see other systems underfunded and overwhelmed and then abdicating their responsibilities. And it doesn't always mean that you can catch them. So I think the observations you're making are kind of heartbreaking, really, for all of us.
I'll just say that my son spent half of his first grade in the principal's office because the teacher didn't want to manage his pervasive developmental disorder, which at that point was not under the autism diagnosis.
Yeah.
So it is really an issue, but I think we have to look at the big picture too in terms of funds.
Yeah, I mean, and I totally understand that. I think it would be interesting just to collect that data to understand what are the actual barriers. Is it that they're not being referred early to getting neuropsych testing, which would be very helpful. I agree with you that the autism spectrum, it's gone through a lot of shifts in terms of how we even viewed that, and it wasn't even considered or quirky or whatever back in the day. And so there's obviously a need. And so I think maybe that's just the doctor in me, just wanting to understand a little bit of some of the barriers that you guys are encountering. Because there are, can be various for let's just say behavioral issues in the classroom. Is it ADD? Is it autism? And once again, it comes down to, is there an issue with access to neuropsych testing? Is it more of a thing of people aren't being referred to that? So that would be an interesting point to collecting that data, just to, I think, help out understanding the epidemiology and barriers. But
Lynn, can you answer a question for us? So this program seems to me to be supporting students after school in small group discussions, right? Did I read that right? Yeah, right. So that was my question. So, and if it's for students who have a specific diagnosis of intellectual or developmental disability, then would we be able to fund this?
You would. There are other problems with the application that we don't need to get into, but yes, if the program could be redefined to only those activities which are clearly outside of the school scope, which that really is, and then only on behalf of people with a fully qualifying diagnosis, which I'm sure you have some, that would work. They would actually have to do some work on the application forms. There were some things not completed that would need to be done, but thank you. Yeah.
So that's something to think about.
Any other questions? All right, thank you very much for the information. We really appreciate it. Moving on to community choices, inclusive community support. And that is Neil.
all right. Yeah, so this organization helps to foster and help people with developmental disabilities, live in a comfortable manner. They're requesting $233,000. So are you from the? Oh, wonderful, wonderful. So it sounds like amazing work that you guys are doing. So maybe you can just give a word about some of the main thrusts that you want to bring into 2025 and where you see your growth.
Sure, absolutely. Excuse me. So for the most part, this program is not changing a lot from, it's a very long-standing program. We have expanded it over the last 3 or 4 years. And I think we're starting to see, especially now within the last year and a half, people really taking advantage of some of those expanded supports that we began offering, I think back in FY22, 23. And so we're very excited to kind of continue that and continue to sort of the depth of some of the work that we're doing with individuals and with families. The other thing that we've added this year is we're kind of like a family futures planning workshops. One thing that we've really noticed is that families sometimes just like don't have all of the information that they need in order to do some of that kind of long-term planning. And so our idea is to create basically a template for like a binder where you can start to sort of organize all of the like the big sort of pieces of supporting your family member with a disability, provide information, and then sort of help them create a document that's going to sort of help lead any sort of additional work or planning or decision making that they might need to do down the road. And so we're very open that, like, you know, we aren't financial planners, and so there's not going to be some things that we can do in that area, but we can help people maybe understand what some of the options are and hopefully get them connected to some resources that will have more expertise in those areas.
See. And one question is that sounds great, by the way. The other thing is, in terms of like, how vulnerable would you be to any kind of state cuts in funding with all this?
Yeah. So one piece of this program that's it's separate from the application here is, but we do the self-direction assistance for individuals with the home-based support waiver. It does feel a little unknowable how that is going to be affected, but that is a not insubstantial part of our budget. And so if that were to be cut or affected, if they changed the rates or made the eligibility criteria different, it's hard to speculate as to what would happen, but it would certainly leave us somewhat vulnerable. Yeah.
See. Yeah. Any other questions?
I only have one question. I noted that you were open to a 2-year contract. Are you asking for a 2-year contract?
I think that was actually for a different program. I mean, I would maybe consider it, but it was for a different program.
Okay, all right. I had that noted on the bottom of my page here, so I went through all the details a long time ago. So.
Sure.
Okay, different program. So you don't want a 2-year contract?
It was not in my mental model of how this would work. No.
Thanks.
I think maybe it was the transportation is what.
It was the staff recruitment and retention.
Yeah. Oh, okay.
Yeah.
Okay. Yes.
I think whenever we can go to a 2-year, even though we don't know about the funding future, I think it's a great idea for reducing paperwork on the agency as well as on us.
Yeah, I would agree.
Yeah.
Yeah, I think so.
All right.
Vicki, can I just real quick?
Sure.
So I would say like the budget comes in every year, so I don't know that we should do that from the county, but it would be nice to decrease, but we probably can't do that. I would just want to say that your goal, your objective or outcomes are beautiful.
Oh, thank you.
They are so. Did you all work very closely with the evaluation group?
We were one of the targeted partners. I think it's been, we've actually worked on this program with them twice. The most recent time I think was in like 2023. It was the last year of the last group that was doing it. But we worked with this woman named Emily, who was fantastic. And really, it was during the period that we were expanding the program. And so we were able to sort of like build a lot of that into just the structure of how we do things. And it was immensely helpful.
Well, and I would just say, like, as we are talking to, community members or county board members about like the things that we fund, this is just great, very specific data on how it impacts. So I think across all the programs, just kudos to your entire staff. Thank you.
Okay.
Yeah.
Oh, sorry. One thing, and I agree. I really liked just like the evaluation and thoroughness, and these are great numbers. The one thing I was just wondering about is of all the metrics was 50% of the participants only indicated that it was helpful in finding sustaining preferred housing. Where do you think some of those issues are?
Well, I think that data ended up being a little bit difficult to look at because a lot of people actually already had the housing that they wanted. And so when we asked them, did we help you? They were like, no, because I'm already fine.
Okay.
So I think we do need to reword that to be like, if you needed other housing, did we help you? So yeah.
Okay, good. No, this is great.
Thank you.
Great.
Okay, thank you, Becca. Let's get it on here. Moving on to DSC Community Living, formerly Apartment Services, and Ann is the lead on that one.
This again is an established program, and they're asking for a 2% increase, which is pretty small considering what's going on financially. And I just want to note that although Community Choices and DSC have programs that look like they're doing the same thing, they're really not serving the same population. So I had a little note at the bottom of my page that the DSC clients tend to have higher needs, more complicated needs. Not that the Community Choices, I'm sure the people have complicated needs, but just looking at the range of services that the DSC clients need, it tends to be a higher level. And that unfortunately, many of the DSC clients lack family support, which is something that Community Choices has been brilliant in working with the families. And I'm sure DSC would be too if the families were available to work with. So I just wanted to point those out, and those are not really questions. So do you have, Vicki, do you have questions you wanted to ask them?
Let's turn the mic on. I'm telling everybody else to do it and I'm doing it wrong. So my question was, you have on your targets, you have 78 people who are receiving services and 74 of them are all served in the first quarter. Am I reading that right? So you have a set number of people that you're serving already. Most of them are living in their own homes in various places around the community, and some are living in the apartment building that you have. Correct? So there is no new population that's being served at all.
Yes, so some of our individuals might come out of the program for various reasons, move out of the area, and then we continue to have new incoming individuals. So for instance, we just had a gentleman, we had a vacancy at the CU Independent Apartment Building, so then we had a newcomer into the program, move into the apartment building, and then access the CLP for the first time.
Okay.
So it's kind of an ongoing rolling number, but our
Okay.
target is to have 78.
All right. Okay. Any other questions from the group? Kim?
Just the budget issues that were reported. So some of the expenses, I think, that are in the budget for things like miscellaneous, the things that were described as miscellaneous expense, I think staff noted it should be maybe more general operating expenses. So I think before we were, maybe one thing we would consider is just like adjusting that so that it's reflective of good accounting practices is something we maybe should consider.
And this is a repetition of an earlier question, but I think again, in the future, it would be really helpful if DSC could note what the waiting list is and maybe the short turnaround time to move someone in, because if you have a waiting list, which I think you probably do, then once there is a vacancy, you're probably able fairly quickly to house somebody who was still living with family members or an unsatisfactory housing.
Yeah, so our CU Independence has a waiting list, but the program itself does not.
I would differentiate those two
Okay.
then, because it's, I actually know several families who are waiting for the CU Independence.
Sure.
And they're patient, but and again, just strengthen your proposal for the future if funding becomes tight.
Did I miss do you have a waiting list for services?
Community living, we just go
Community
through the
living.
admissions process. CU Independence, we do.
Okay.
The apartment building itself.
Okay. And so if you have a waiting list and there's something in here about doing advertising and promotion. Do you do that
For CU Independence specifically?
for the community living thing?
Yeah, we go to events and promote the program. But we don't have a waiting list for community living
Got
itself,
it.
just the apartment building.
Okay.
But yes, we're very involved in the community to make sure people are aware of the program.
All right. Thank you.
Yeah.
Any other questions? Thank you very
Yeah,
much.
you're welcome.
Okay, moving on to, where are we? Transportation support, community choices. And who is, that one is me, I think. Okay, that one is me. All right. Thank you, Becca. Welcome back. I think we'll be seeing you again.
Yep.
All right, so just to summarize, you are providing transportation 7 days a week?
It's Monday through Friday, from 8 a.m. to 8 p.m. So we are not able at this point to do weekend rides.
And you just hired a fourth person not too long during this past year to provide transportation during peak times. What are the peak times?
Yeah, so the peak times are by far like the 8 o'clock to about 3:30 period. I looked at the numbers for this fiscal year so far, and just based on our calendar, some of the rides, excuse me, on the calendar are like our group rides, so this doesn't account for that. But 40% were between 8 and 12 a.m. In the morning, and then 41% were between 12 and 4. And so that left about 19% that happened after 4 p.m. and about a quarter of those were for our social opportunities. So that peak time we've really just very much seen be during the day. And so the position for FY25 was to expand the coordinator role to be a backup driver. So it went from a half-time role to a full-time role. So they're still doing the coordination, but then able to fill in rides when there's like 2 people request a ride at the same time, and there would have otherwise been a need to tell somebody no.
Okay. Any other questions for Rebecca? It's a great program. Thank you so much. Oh, wait.
Yeah, I just wanted to once again put on the record, I was interested that when we reviewed this last month or whenever it was, that a lot of these rides are for people to do employment.
Yeah, by far.
They're
by far
allowing people to participate in employment in the community by getting a ride. So I just wanted to point that out.
Yeah.
I was surprised how high that number was.
Yeah.
I'd like to see it expand eventually.
Yeah.
You know?
Understand.
Yeah.
Absolutely. Thank you.
All right, let's get to clinical services, DSC, and I have my name on that one.
Yeah, and I think I'm the lead
You're
on
the-
that one. Should I start?
Go ahead.
Okay. So obviously, again, this is a responsive and continuing proposal to support clinical mental health counseling, psychological services for current and possibly new clients who cannot access those supports, mental health counseling, psychological services through insurance or Medicaid. And we don't know how much more limited that may be in the future, but it's probably not going to be more generous than it is right now. So without a question, this has been a longstanding and important program. I just had a couple of questions. And again, I think these are more to strengthen perhaps future applications than so much this very application. But clearly adding insurances that all clients receiving those services are not eligible for community-based or insurance-covered services, and that, the only option is through the independent consultants and others that they're going to. And I'm assuming that that is the case, but just a clear assurance that that would be helpful by even noting the number that are served who have no other source. And then I'd like you to verify, and this does relate to this proposal, that psychological assessments are not part of the services if they're required for clients to be eligible for PUNs. Now, if it's to go beyond the PUNS eligibility, then of course it makes sense that you would be funding that. But if it's to establish PUNS eligibility, that already has to be in place, right?
It is our understanding that Prairie Land will only pay for a psychological once someone gets like a letter. And so in order to establish them, if they have no other documentation that they have a developmental disability, that's why that was part of our grant proposal last year that was approved.
Okay.
So that we would, because psychological assessments cost like anywhere from $500 to $1,000 to
$2,000
upwards.
Yeah.
And people do not have the means to do that. And so, I mean, we're utilizing that very little. I mean, in fiscal year 25, we've only done 7. So I don't feel like we're over utilizing that service, but I understand your caveat of they should be on PUNS to get services, but to get some people on PUNS, they may need a psychological. And so they are not eligible for any of our other programs unless we get them on PUNS.
Well, I'm really disturbed to learn that, not disturbed at DSC, but disturbed at ISC, that they're not providing that support, because how do you become eligible unless you have all the necessary assessments? So this is really
I think the
a systemic
eligibility
issue.
actually, eligibility actually happens after their name is drawn for services. So they have to get on the list, and it's just, the ISC's best guess as to whether or not the person qualifies. The real qualification comes after that draw.
Right, I remember that.
Yeah.
But still.
Yeah, they're not, ISCs
Isn't
don't
this
have the money or
they
the
don't have-
interest in providing all those assessments.
So this is, go ahead, Lynn.
We had it solved a few years ago because when the ISC was
Here.
Regional Planning Commission.
Okay, well, let me just withdraw that concern then, given that it's a systemic issue that we don't have the power to control at the moment. And I think your outcomes are really appropriate. And my only other concern is that the services are almost completely dependent on this grant from the CCDDB. I don't know if you have any other options to diversify support or not, but I would encourage you to look in the future. I know that the DD board has been able to really provide a lot of substantial support to the major agencies in the community, but we're also somewhat looking into an unknown future. So, very important service that DSC is providing, ongoing, well-established, no other concerns. Yeah.
I don't have questions so much as comments again, that I just want to get on the public record. First of all, it's very clear that this program is providing services that are not billable to Medicaid and Medicare. So that is an important criteria. But the thing that I really like about this service, it's expensive because we're dealing with licensed and highly trained professional staff. But what they do is work with the team approach, and that's emphasized. And they provide support for other staff, including direct service professionals, on how to deal with the special needs of the client. So it's not just a one-on-one occupational therapist dealing with the person, but also training the staff and working as a team support. And I think you get a lot more value for your dollar by doing it that way. So I just want to put that on the public record.
So can you walk us through objective or outcome number 3? It seemed like you all mentioned you had worked with the evaluation group to develop the self-assessment.
We have worked with the evaluation capacity team, numerous different programs have. This was actually the wellness survey that we created using things from the bank that the evaluation capacity team created. So they have a bank of different questionnaires, and we worked with them to pick and choose different parts of questionnaires from those banks that would work to show whether or not someone felt like their overall well-being was positively affected by participating in these services.
Can you clarify for me, is this a new objective from the previous year, or have you been?
No.
You have
This has been the same one.
You have been, okay.
Mhm.
All right, thank you.
Yep.
I'm sorry that I did not, I
That's
apologize
okay.
that I did not remember that. So I just want to kudos to you. That's great. Thank you for doing that.
I think I did rephrase it slightly, but in essence, it's the same. And that the rephrasing of some of our outcomes came directly from working with like one of the micro learnings with the evaluation capacity team, where they were trying to help us understand the difference between just like the input versus the actual outcome. So some of them have been rephrased, but they're measuring fairly much the same thing.
Which is the things that we're reading when we get the quarterly reports and things like when we're like, oh, it's great to hear like the stories behind people's experience. Okay, great. And then I just want to bring up, I don't have to lean in that close. In the staff, the caveats. So there were several concerns that were listed in the caveats. It's on page 37 of our board packet. So, and I guess I just wanted to give you a chance to respond or for staff to kind of talk about. So there is recommendation that there be revisions to the prior to contract. There's some discrepancy between the forms, like numbers that were miswritten, and then some expenses. And if I remember correctly, it's the same type of expenses as general operating expenses. Is that correct, Chris?
Yeah, it's just some recategorization that needs to be done. Expenses that didn't fall in our definitions.
And then just a couple forms had numbers that were miswritten. Is that right?
Correct.
Okay, and that's an easy fix for us to do before we kind of approve the contract, or how would that work?
Yeah, those are easy fixes.
Okay, great, thanks.
Anything else? Any other questions? Thank you very much. Okay, next thing up is individual and family support, DSC. Is that the same people? No? Still you, okay. All right, and Neil, you're the lead on that one.
And so this is an effort to do something that's very important, and that's like supporting families and giving them needed breaks, and trying to take care of the care providers, which is, I think, very, very important. And so they're asking for $320,000, which represents about a 4% increase from the previous year's budget. It seems that most of that increase is adjusting for inflation for staff. So a few things is that, I think kind of piggybacking on a previous issue is, the need to diversify funding, I think is really, really important, because how vulnerable would you be, or what would you see as like expected increases in costs due to any cuts in state funding or federal funding?
So for this particular program, there's a couple different aspects of it, but for the respite piece itself, it is strictly DDB funded. If somebody has waiver support, they cannot participate in DSC respite. What I could see happening is there are 2 other respite programs in the state that individuals are eligible for. We encourage them to sign up for all the respite that they can get, because what we provide is certainly not enough for the breaks that some caregivers need. There could be cuts to those programs, which then would put more of a need on people relying on our respite supports. If they did not, qualify for those other things and didn't have waiver funds. The other parts of the program, so the self-advocacy portion, that could be impacted just because if someone's doing advocacy that has waiver supports and their services have been decreased or cut, then they're not also able to participate in advocacy because they wouldn't be receiving the other supports that DSC provides. So that's how I see for this particular program is kind of unique, because it is mostly DDB funded, the respite part, all of it DDB funded.
Yeah. One thing was like in just the outcomes, or just sort of your narrative of what is the big plans for this year in terms of like, are you going to do more retreats or what's the big push this year?
I think since receiving funds to be able to have an actual position dedicated to this particular program, we have already increased the advocacy that we have been doing. We just had a group last week go to the Capitol. We have every other week or so, there's groups doing advocacy training. There's just a lot more opportunity. And so our push for the future is just really listening to the advocates. Some of them have said they want to like have their own conference and they want to do more of their own sorts of speaking up about the things that they find important, and they want to help other people speak up that maybe haven't had a chance to do that before. So it's just continuing to grow that advocacy portion of the program.
Okay. Sounds
Yeah.
Any other questions? Go ahead, Susan.
Can I add in? Okay. Advocacy, respite is so absolutely essential to keep caregivers in the loop. So no questions about the respite. But I did have some questions about the advocacy and again, as a way of perhaps strengthening future proposals, could you tell us how many clients, you don't have to do it right now, but how many clients of the 40 TPC treatment plan clients actually engage in advocacy efforts? And does it overlap at with any of the community choices advocacy efforts? Because there are a lot of advocacy efforts happening in the community.
Sure.
And how much can you
coordinate
and maybe save money that way?
Sure. We have, when we came and spoke to the board, that was a joint effort with Community Choices, and the resource coordinator and I have talked about, are there other types of things that we could do with Community Choices or other agencies as well? So we're certainly open to that. As far as your question about the TPCs, for this particular program, the treatment planning clients are those that are receiving respite.
Okay.
Yes, Lynn?
Just to own it, I made that mistake in the chart. Like I flipped TPCs and NTPCs. It's correct in other places in the program summary, but you have identified continuing 40 TPCs and 20 NTPCs. I'm so sorry.
That's okay.
We all look at these things and for so long,
so
sometimes we do miss. I'm very sorry.
That's okay. So the NTPCs represent those that are participating in advocacy.
So 20 are participating in advocacy.
Yes.
Okay. I think just clarifying, because it gets very confusing with all of the jargon,
Sure.
just in the quarterly reports and maybe in the annual ask, just stating how many DSC clients have participated in advocacy in the year, because it's impressive if it's a large number, and these are not often people who speak for themselves.
Mm-hmm.
So I would like to just know that. And then I wondered, of the 6,938 hours provided in the program, what does that look like across? I would assume most of that's respite.
All of that is actually respite.
All of that is respite. Okay.
Previously, when we did not have a position dedicated to the advocacy portion of it, advocacy happened kind of sporadically, usually just the Speak Up, Speak Out Summit, maybe not a lot of other things. And so we were not putting claim hours into the DDB system. And I noted that was one of the things that was suggested. And we're certainly open to doing that for the NTPCs so that you can see, I probably would need to work with Kim, like how would we want to delineate so they knew it was advocacy or healthy relationship type support. As opposed to respite, but what is in the system currently, all those hours constitute respite.
Okay. Well, I don't mean to nitpick at all, but I just thought, well, 6,900 hours is a lot of respite, but how much of it is advocacy? Because I was lumping everything together.
Yes.
So maybe clarifying the two programs. I know they're under one title, but having maybe some separate description of what the advocacy efforts involve that clearly are not part of the respite. Because I'm very interested in increasing advocacy. I think it's so important. And then, that also left me to wonder, how does the resource coordinator determine what funds are used for respite, what funds are used for advocacy, what funds are used for other activities like the YMCA and fitness memberships? It just started to become kind of crowded and cloudy when I looked at all the different things that you could do with some of these funds.
Sure. So I don't break it all down in the budget, but I know it is broken down. We have a certain amount of money that is line item for respite providers to provide services. We have a certain amount that is line item to be for specific assistance. So that would be for specialized camps or those YMCA passes for some of the respite families, or if they need some sort of modification that the state won't pay for and DDB has approved. And then there's another line item of money that is for advocacy only. And I don't know the breakdown of that off the top of my head, but it is broken down in our budget and what gets submitted to the board in terms of like different line items.
Well, and I'm not questioning, the legitimacy of what you're doing. I'm just saying, for us in reading the application, it seemed more like a mishmash of activities than it did advocacy and respite. And clearly the majority is respite, which is so critical. But I'm very curious in following your advocacy too. I think that's equally, well, not equally, but also very important. And it's just hard to know what is advocacy and what is not.
Sure.
As the budget is presented, or the proposal is presented this year. So I may be speaking more about next year's proposal than I am this year's proposal, trying to clarify.
Okay.
And then things like the YMCA camps and all, in some ways, those are respite because they allow adults to go to summer camps or to leave home, which I think is fabulous. So it may be important just to say respite includes individuals who come in and care for the care workers who come in and care for the individuals, so families or other care workers get a break, but it also can include opportunities to go to overnight camps and things like that, because they're both forms of respite. And it's just easier for me to kind of grasp the range of respite opportunities available.
Thank you.
That's all I have to say. Thanks.
Other questions?
No, I agree with that point too. That would be very helpful, with the respite, just to sort of describe a bit more of like, what are the services and what are we accomplishing? But then I think you also brought a very good point, and I think that has to do with like more to all agencies, right? So things like advocacy, that's pretty universal. I think we all in this room are wanting to be advocates. And so I think, I don't know what the future will hold, but I see this as an area where there could be some shared, if agencies work together on this, that maybe that could be, a little bit less cost per agency together, and that there may be a more of a synergy, just in case we start to have other budgetary constraints. I think, it's something that we all need to think about.
Anything else? Okay,
I have
thank
a
you.
question.
Oh, Kim.
So, pardon me if we address this, but like this looming surplus that DSC has, how are we? Because throughout the packets, like it was suggested that we ask them, could any of the surplus be used to pay for programs instead of DDB funds, and maybe we could reapportion those DDB funds to other things.
Which is stretch
So,
our budget a little bit.
Right.
Yeah,
So I guess
yeah.
I just don't know, how do we want to address that, or?
Well, they weren't all the same. So there are some where we see, and I'm kind of speaking for Chris, this was his observation, but there are some where it would just be so that we can see lowered program deficits, which wouldn't affect DDB funding. But if there are places where a fund is either underutilized. And I wanted to be really careful because if it's underutilized due to staffing vacancies, I don't want to recommend starting at a disadvantage, right? Since we all understand the issues around staffing and also how important continual staffing is. So not to start there, but in this program, there is a set amount of money used for specific assistance, which is not always all spent and is also now redundant to the IDD Special Initiatives Fund that you have. So maybe the prior underspent could justify a lower amount of contract for this particular one. It's not true in every case, but there were a couple where we were looking at, you know, it's underspent and wouldn't be harmful. Did I get that right, Chris?
Well, I think she was talking about the total agency surplus that all the budgets indicated. And now obviously that's just a budget. But we have to ask the question, you know, we have the rule in our contract that says DDB funds are payer of last resort. So if there's other money on the table, those funds have to be utilized prior to our funds. So if the agency is showing a surplus, then we just need to ask the question, can that surplus be used instead of our funds?
So thank you for clarifying. Yeah, that's kind of the issue I'm addressing. So I don't know when in this process we want to actually ask that question to them. Should we wait till the end or? Oh, thank you, Danielle.
I sent an email to Lynn. We're gonna address it. It isn't, I can't just move funds like that. They're all reimbursement based, as Chris knows. So you are only paying for the services that we provide. We pay everything else back to you. So it's not as simple as moving a surplus. It's a budget, and that's for the whole agency. So I can't do what you're asking me to do, because every program is its own program. So we are getting ready to draft you something. I couldn't respond in time to get it out to you for this meeting, but I will get you something.
Perfect. So
But
like
the answer is no, I can't do that.
Well, Danielle, thank you. And we will share your email with the group and then also in the May board packet. Sometimes these questions we can't take them on during this meeting. They might be something we talk about in May, or even after you've made a contract award, it could be a discussion point between us as part of contract negotiation, but that is pretty clear what you just said.
I think it's very different if you have a grant-based program versus a reimbursement. I mean, everything's a little bit different, and we're only paid for the services we provide. So there isn't a way to do that. So I think if it were a different type of, it varies. So
I think having this on the record is what's important. As people in this county look at what's being spent and where it's being spent, and they're looking for places to be cut, someone could find that information and go, why are we spending this money on a program where an agency has this amount of money? Kind of floating. And as the payer of last resort, we can now state we are indeed the last payer of resort, or however you phrase it, Chris. Do you know what I'm saying?
Yes, and every program has its own revenue sources, and you can't just move revenue sources from a different program to that program. They're unique. And so, yes, we can definitely elaborate on that. I know you had questions on the other one. Like Chris said, it's reclassifications, very small reclassifications. We can do that very easily. And then one was just an error misunderstanding. We will clarify that as well.
Great, thank you.
Thank you very much. And moving on to Consumer Control and Personal Support, PACE, and Anne is the lead on that one.
Okay, I don't have a whole lot to say about this. This is an ongoing program. We've had longtime support. The amount that is being requested is about the same. Well, it is exactly the same, 0% difference from last year. And the only thing that I would add is there were some process considerations and caveats from the staff that are contracting considerations that I don't really want to get into, but I think those are things that can be worked out once the contract is approved by the board. Am I right, Lynn? So we don't really need to discuss those specifically at all. There's specific things that the agency needs to do, but we don't need to discuss that.
Yeah, I have no additional comments to make other than I'm glad the program exists. I think it's a good resource for families who have that funding, and I don't know if you have anything to say about the successes, but I have not heard any negative comments about people who have gotten PSWs from this program. So thank you for your work. Sorry to make you to come up here for nothing. We didn't have any questions. Yeah, nice to see you. Any
Yeah,
other
it's good to see you in person. Thanks for making the effort.
Okay, next up is the Parkland College OT at Head Start West Early Childhood Program. And I'm the lead on that one. Apparently, it's my understanding that this program has been established. Is there a person here from Parkland?
Hi, I'm Josh Berkey. I'm the program director for grants and contracts, and we also have Stacy Youngs on the call, as well as another grants office person, Lily Warby. But Stacy's the head of this program, and she can answer any kind of programmatic questions you have, and I can deal with any logistical questions you have.
So this is an existing or it has been in an existing program, and this is a new request, correct?
Yes.
And what happened to your prior funding for this program? Why are you coming forward for a request?
So this would be an expansion, and Stacy, if you want to touch on the kind of expansion and the idea that you've got, that would be great. I think you're muted.
We couldn't hear you, Stacy. Can you repeat?
Did you hear anything?
No, I'm not hearing it either. But
Okay. Oh.
so it is an expansion of services. So the OTA program exists and it works with Head Start, and they've worked with Head Start for a number of semesters, but this is expanding it into more supervision for more students, to allow more students to provide services at at Head Start West.
Are you guys able to hear me now?
Yes, there you are.
Yay. Sorry, my work monitor struggles. Okay. Yeah, this is a program I started I started dabbling in it last spring, and we started this fall. It's pro bono. We've just kind of like slowly embedded it within our fieldwork program. And I've been going to Head Start West, just using some small clinical time. We've had 2 students there throughout the whole semester. I'm there about 8 hours a week, and then I support them when they're there and I'm not there. They're 2.5 days at Head Start. So it was just kind of a trial program. It's something is not sustainable within our fieldwork, our clinical education. Like, we can pilot programs and try to start programs, but then to continue, we have to get funding for staff. And I don't have the time, because I am program director now at Parkland, to be like the on-site occupational therapist overseeing all of the treatment there.
Okay. Do you have questions, Kim?
So this seems like it is I'm a special educator myself, so it really does pain me to say this, but I mean, I don't know that we're authorized to provide funding for this particular service, because it is typically something that would be covered under IDEA or Medicaid, right? Doesn't Medicaid pay for OT services in schools? And this program is actually providing OT services in schools.
I mean, it would, but Head Start doesn't have clinicians at their site, and we don't have the capability to do Medicaid billing. I mean, I have had a private practice in the past, and I have done insurance billing, but that's not my role at Parkland. We would probably have to hire support staff to do that. Some of the kids are going to Unit 4, but we're serving the kids that aren't going to Unit 4 for whatever reason. The advocates are working with them, but they haven't been able to get connected with Unit 4, or they aren't yet connected with early intervention on the EHS side. So we're trying to fill that gap. We're also trying to do population-based services where we do preschool groups every week in every classroom. So we're serving at least 90 kids that way, just doing motor activities, self-regulation, and just supporting the teachers at Head Start.
Yeah, go ahead.
So Head Start is separate from IDEA. They do serve or are mandated that 10% of their population that they serve be students with disabilities. Of the students who are served by the OT program, I think the real question is, do they fit the criteria for funding from the DDB? And if they don't fit the criteria, then it's a problem. I love the program. I think it's so important. I think kids in Head Start are often overlooked and underserved for occupational therapy needs. But I'm not sure that the youth in the program, the children in the program, would normally fit the DDB funding criteria. So
I would say they do. They just haven't been identified or diagnosed.
Right, which is
Mm-hmm.
that's a real problem, unfortunately, with the DDB is the diagnosis. And it really, I guess the issue comes up with early intervention, which DSC does too. And I certainly don't want to not fund early intervention, which is supposed to be state and federally supported, but realistically is not. So I think this is an issue not just for Parkland, but maybe for the board to wrestle with.
Well, and let me say, early intervention stops at 3, so a lot of the kids are 3 to 5.
Hey, Stacy, can you hold on?
Yeah.
Mental Health Board is the funder of the DSC Early Intervention Services. And this is partly because when you were on the Mental Health Board, there was a high concentration of board members with deep knowledge of early childhood services. So it was a good match anyway, but then we found it's also good because the eligibility definitions are slightly different. Yeah.
So would this be a better fit for the Mental Health Board?
There are some.
So I believe in Lily Warby's on the call who helped with this application quite a bit. I believe we had a discussion early on whether to categorize this within the mental health request or within the DDB request. And I can't recall because it's been quite a while of what that conversation ended up with. But I know we had that conversation and we were, I think, directed to go this route and not the mental health route, but I'm not 100% sure or can recall that conversation.
It's okay. It's okay that you chose this route. It could be considered by the Mental Health Board, but they don't have enough money to do it. And because we didn't put this on their list of applications to review, I mean, we didn't talk to you about that. I don't remember seeing it indicated in the application that we should. So we didn't do that, but and it's not too late. It's really not, but they are about $450,000 short of being able to fund all the things that are requested. So with the DD Board's blessing, I could say to the Mental Health Board, the DD Board would like you to look at this one too. And then just, throw it in there and see what happens.
Neil?
Sorry. So, this is obviously, I hate that I have to bring up these issues because I do support early intervention and all this, but part of me was just a bit confused at why is the DD Board funding this and not Parkland as well? Because this is also expanding your opportunities you offer for your program, which you are charging students for. So I think that's another big piece here. And then for Medicaid billing, I think that's also another area which should be looked at first to see what costs can be recouped. So, I mean, because a lot of these should be covered. So, yeah.
Can I comment on that? For our fieldwork sites, we don't get funding for that. The community members take our students. That's just it's similar to occupational and physical therapy at the graduate level. So when they do field work, they go out and we have a community partner, and we're not, I mean, yes, they're paying a tuition, but we're not paying our community partners to take students. And historically, this is how DSC got occupational therapy started at DSC in the late 90s. We had a partnership like this, and then they ended up hiring an OT, which is what they did through like the funding through the Developmental Disabilities Board to help support that. So we kind of view it as a way to try to build connections in the community where people are not getting services. That's kind of my take on it.
Cece, can you clarify your outcomes? Because it says here in the outcomes that you're addressing the needs of students with IEPs. Am I reading this right? So,
Well, we're just like supporting them. If they have an IEP, we're supporting them and like helping the teachers implement that because they're not getting communication from Unit 4 typically, like not consistently. Mostly what we're doing is we screened probably 40 kids on the preschool side, and we're doing small groups and individual treatment, not with kids with IEPs, like kids that aren't getting them. And then we do in classroom groups every week. And we're building on a curriculum evidence-based learning without tears, a handwriting kind of letter recognition model that has motor components. And that's the biggest kind of service delivery that we're doing at this time. I want to get over to the early Head Start side, birth to 3, but we haven't really had time to do that. We've done a little bit, but
I mean, that's really typically covered by, that was my biggest concern. That's really typical. It may not be covered by Unit 4, but statutorily, we can't fund something like that. Right? I mean, but
No, I totally agree. Yeah. I mean, we're picking up the kids that don't have IEPs. So many kids there. I know in theory, it sounds like they should get to Unit 4 and get an IEP, but there are so many barriers for families that they just haven't been able to do that yet. So I'm in essence, I'm hoping to help Unit 4 instead of having kids show up going to kindergarten that have had zero support, that we can try to like give them some support before they get to kindergarten.
I appreciate the effort to help. I just don't know that we are the people to come to for funding this.
Well, we have to be careful with that. Anything that's covered under the School Code Article 14, that is in the law. So that's a kind of a big barrier, but there's also, if we want to talk about what it means, there's also, it becomes quite political quite fast because everybody else we're talking about is property tax based. So it's kind of like one taxing district, not bothering the taxpayers with an increase because they're going to get it from a different taxing district. So this is, we find ourselves in this position quite often because of the stresses on all of these taxing districts. It's real. I'm not gonna, it's not casual. And I really believe you that the needs are there, but it is problematic. We would have to tease out exactly who's who. It's not kids with IEPs. It's kids who are eligible under the school code.
Neil, did you have a comment?
I guess I still would have my same thing of I think it's important to kind of figure out and strategize your other additional funding sources. Be it from tuition that helps to offset some of these new projects, research and grants that may be related to understanding how your services may be actually beneficial. So that could also be another source of funding. Also, some of these the schools that you're at, why aren't they asking for funding as well if that's like part of the need? So, I think that that's important, especially since it's sort of like it's also adding value to your program as well. You're adding value to the community. I get that. And I, like I said, very much like love the aspiration. I just think that it's important to sort of make sure that you're utilizing all your other sources of revenue. And if there is Medicaid reimbursement, which may not be great, but still it's something. And I think that that's important to think about a sustainable program going forward.
Are we good? Okay, thank you very much.
Thank you.
Moving on to customized employment, community choices. Welcome back, Becca. So this program uses the model of customized employment to help people find the job that's meaningful to them, and then you provide supports to that individual based on whatever their needs are to help them be successful in that position. And you have served quite a number of people over the years. Is the total number reflected in here, or is that just over the past year?
I believe the number in the application is the number of people we served in FY24 as the full year, and then so far this year. That's a great question of how many people we've served over the whole life of the program, and I don't know.
You should probably gather that information. I think that would be good to know. It's been a great program, I think. One question that I had on this was under the measures of utilization, and you talk about the wait, am I looking at the right one here? No, it's me. I'm just losing my place here. Oh, I'm back in Parkland College here. Yeah, here we go. Under measures of client participant outcomes. It's on 53, actually. So you talk about short-term support, 20 individuals becoming independent of their jobs through job negotiation and coaching within 2 months of their start date. But then above that, on number 3, you identify 20 people, 13 individuals working to obtain paid employment and 7 volunteer employment. Are those the 20 people that you're referring to?
I'm sorry, I don't have it in front of me. Could you say that one more time?
Okay, so let me do this in order this time. So on number 3, under job matching, you have 13 individuals working to obtain paid employment.
It does.
So those people are the ones that are referred to under the under the short-term support?
Yes. So essentially, the short-term support is referring to job coaching, getting people comfortable and getting them to a place where they're feeling independent and confident on the job. And so the 20 people that we refer to in outcome number 3A, those are the people who are receiving the bulk of the job coaching. And there are instances where we would go back in and support somebody if their role has changed or a manager has changed. They're just like kind of having a rough time. But no, in the outcomes, those are the same 20 people.
Okay, that clarifies. So have you ever placed a person who needs ongoing support, or do you try and manage that through the employer?
It really varies. I mean, the length of time that we're able to provide job coaching really varies, and we try to support people to the extent that they need it. If somebody is going to need like consistent ongoing support for the entirety of their employment, we would most likely work with the family and the employer. If the person has home-based support, we might work with them to identify a PSW who can continue on and provide some of that one-on-one support that they may need on the job. We've definitely done that before. We have job coached for up to a year. I would not say that is typical. But we've kind of tried to look at it on a person-by-person basis.
Okay. Are there other questions?
What are the kind of jobs and volunteer jobs that people are getting?
Sure. Yeah. I mean, it's a huge range. Gosh, let's see. In the last year, I mean, we've had somebody, we were really excited. There was one individual who actually got hired at the university doing their building services. And we've had a hard time getting into the university. So that felt like a real big win. But we've had people, of course, now my mind is going blank, but area sort of businesses. We had an individual get hired at a local bakery. We've had one person was hired at FedEx this year, is doing well. One person is working at a childcare center up in Rantoul. We've got somebody who's working at Culver's. It's kind of his first job. We've had a couple people who worked seasonally with the pumpkin apple place. What is it? Curtis Orchard. Thanks. And that went really well, and they're expected to like be offered jobs again this summer.
Salt and Light.
Salt and Light is, for volunteer opportunities. That one has been a good fit. We have somebody who's working at Moore's Rescue Ranch. She's really interested in animals, and so she's been helping out with the cats over there on a volunteer basis. It's the hope that that's going to help her be able to find a job at one of these new like cat cafes that are opening up in town. Just get her all ready. But yeah, it's a really wide range.
Yeah, I just want to say, like, I think this is amazing, and I think that this is sort of an important aspect that, yeah, you can have a developmental disability, but you can also work, and there are meaningful ways of engaging, and so, what do you see as like some of the biggest barriers that you face with businesses and such?
Yeah, that's a great question. I think it really depends. I think finding businesses that are willing to be a little bit flexible in the way that they formulate their jobs is certainly one barrier. We talk to a lot of businesses where we'll go in and they'll say, hey, well, no, you have to be able to do everything. You've got to stock, you've got to be able to run the register, you've got to be able to close. And a lot of the folks that we're working with, the cash register is a big barrier for people, or they just sometimes I think, I'm like, you could do this, but they don't feel super confident about it. So getting a business to say like, no, it's okay to have somebody who's maybe just doing some of the customer service and the stocking, but not actually working the register, just as an example. I think for other people, I mean, just businesses are busy. Sometimes just being able to build the relationships that we need in order to like build that culture around having a supportive workplace. Sometimes that's hard. I mean, and we'll talk about the LEAP grant here in a minute, I think. But so we're doing a little bit of groundwork to sort of help with that. But that does still come up pretty frequently, just kind of hearing back from people.
I mean, yeah, exactly. And so that's like one thing is, are there any incentives to businesses for hiring this population?
Yeah, there are. I'm not a huge expert on exactly what those are. I think that businesses can get some tax breaks and things like that, but I'm not exactly sure what those are off the top of my head.
Yeah, no, I mean, that's like, hopefully we can do that. And especially, you know, that's like a big concern. If there is like economic downturn, how would that affect the businesses? So maybe that's also a piece of advocacy that we can advocate
absolutely.
for.
Any other questions? All right, thank you very much, Becca. Moving on to DSC, another employment program, community employment. So DSC employs quite a few more people. That's just a bigger agency than Community Choices, using a slightly different model. And this one is, it seems to me that a lot of the work that you do here is supporting not just individual people, but also groups of people to work together in locations. You want to talk a little bit more about the structure of the program?
Yes. Oh, good. It's still on.
It is.
Hi. Hi everybody. Again, I'm AJ. I'm the new Director of Employment Services at DSC. But yes, we have I'll start with the group employment, which we call supported employment. We have a variety of connections with businesses throughout the community who hire a small crew of people that we support ongoing with a job coach there kind of at all times. So we have connections with some Park District buildings, an ambulance company where we restock and clean, certain things. But, identifying different places in the community that would hire a group of people and building those relationships. Just this type of structure is more supporting people who have a little bit more higher needs in that respect. So making sure that we're able to support everybody who wants a job. That's kind of what we're doing here. Competitive employment, just, making sure that we have people who are providing the support to one person in their job search. Yeah, that's kind of the difference. Again, I apologize. I'm the new guy here, so.
That's okay. Everybody has to be new at some point, right? So not a problem. How many people have moved from the day program into employment historically each year?
He's looking at me because I'm the numbers person, although I
That's
didn't bring
right.
those numbers with me, so I could try to speculate
Is there a
that.
specific effort that goes into that? Because you do have a pretty active
I think it's
day program.
I think it's hard to determine that because we have some individuals that receive both types of services. So they may work in community employment 2 or 3 days a week, and the days that they're not working, they're participating in community day services
Oh, I see.
or a
Mhm.
community first group. And so I think that would be really hard to figure out. We'd certainly have people that come in and all they want is support with community employment. But we have found that, based on people's needs, they may not be able to work 5 days a week. And so they fill their other days that they're not working with different activities that they're interested in.
Other questions? Susan, you were a second on this one. Oh, you weren't. Okay.
So thank you for your application. One thing I wanted to just highlight is this is the one, the work-life balance. You guys address work-life balance. Do I have the wrong?
Oh, you're thinking of Employment Plus, I think,
Okay.
which is where we offer something for people to do. I believe it's each month. I'll let AJ speak to that a little bit more.
Yeah, so Employment Plus, what we're doing with that is helping people who are working, who might not necessarily be doing other social programs at DSC, connect with each other and talk about things that they're experiencing in their employment journeys, and just building relationships with other people who are working. One thing that we're going to be doing next week, the next Employment Plus event, we're going to play trivia as a group. At Harvest Market, which we're excited about, just making sure that people are out in the community and connecting with people who might have shared experiences in employment.
So I just want to commend you all. That's a research-based practice, is helping support people. It's not just about getting the job. I mean, you all know this, but publicly, getting and maintaining jobs, but also having a full life. So I really like that part of the program. So, and I know, so I just wanted to mention that. And then the other question I had, no, actually, that was it. That was it. So thank you.
Questions from others? No? All right, then. Thank you very much. And let's see if I did this right. And I apologize for stepping on you there, Kim. That was your lead there.
This is I think an issue for later that we can bring up. And I think this is a thought for all the agencies is cooperation. In what ways can you guys work together or create an overarching organization? Because it seems that there's a lot of the shared mission and goals. And so does that mean improved organizational efficiency if there's a collaborative sort of effort regarding things like advocacy or employment? But
Well, interesting. You should mention that because we're going to be doing that next one
Right now.
right now.
Perfect.
Yeah,
That was a
yeah.
perfect segue.
Perfect segue. Community Employment First is a collaboration between Developmental Services Center and Community Choices. It's been going on for a few years.
excellent.
So this particular program, and correct me if I'm wrong in my understanding, it's that they reach out to employers, potential employers in the community to help them understand what it would take to support individuals with disabilities to work in their business. And then it has historically been true, it's certainly over the last year, that people from one or the other of these agencies find work at those businesses. And this has been going on for how many years now?
I think it's
4 or
9
5?
or 10.
Is
It's
it
a
really
very-
that
yeah.
much? So again,
Yeah.
start collecting your data about historically.
Yeah.
What have you done? Because I think there's a lot of work that goes unrecognized because it's split up from year to year to year.
I believe that we've trained just over 200 businesses over the course of the run of the program, which I do think is at least 10 years because it was here in 2016. So
Yeah, so you're keeping, I think you just started keeping records on the number of people that actually gained employment from this effort, which I think is great. And I think it's also important to know the number of businesses. But are you in the measures of client participant outcomes? In the staff comment, they talk about the types of jobs acquired and length of employment, knowing that would help strengthen the proposal. You're not, but is that requiring them to predict or report in advance? I don't think that, maybe I'm misunderstanding that section, so I'll let that go and figure that out later.
I have a comment related to that though. Okay, so I'm really excited about this program. I think it's a great idea. It's unique to our county, and I'm going to just put in a plug for you to do something that might get it some national attention or at least regional attention. Yeah, and it's innovative in that you're going to the businesses and providing them with workshops on why should you hire individuals with disabilities? What can they do for you? And I think that, if 10 people are hired by LEAP trained businesses a year, that's great. But I suspect it could be more than that, and it probably is more than that. So I would make a bigger deal of it. It seemed like a small outcome for the potential. And then outcome 2 was 90% of the LEAP attendees will be satisfied. That's the businesses. I would expect that if it's a good training. What I'd really love to know is the number of businesses trained each year. Knowing now that you've trained 200, that should be highlighted. The average hours of follow-up provided to newly trained businesses, because your training is only an hour, but you do follow-up. And I don't have a sense of, are some, oh, well, thank you very much for the training, but we're done, versus thank you so much for the training, we'd like to get more information. So just either average or range of hours follow-up. And then the percentage of LEAP trained businesses that have hired a person with DD from either agency, in the last year. So obviously people don't stay in jobs necessarily for 10 years. You've been doing it for 10 years, but how many people have been hired? If you looked at the active agencies, the agencies that have remained active, maybe not all 200 have, what percentage higher? And then how long do people stay in the job? So even being able to say for those who were hired in 24 or in 23, did they last? And if it was a seasonal job, did they make it through the season? And then I also would love to see the topics that you cover in the monthly webinars that are offered, because that's kind of a freebie that you provide to the agencies that have gone through the LEAP training, right? And I think having monthly webinars is a fabulous idea for keeping the idea alive and present for businesses. And even though they may not tune in to each webinar, maybe based on interest, I would love to know what you're doing. And then finally, I went to the directory because I didn't realize there was a directory. And I worked through the directory because I'm always thinking of, maybe there's something for my son. But I found the directory was kind of hard to use. So again, not for this year, but in the future, looking more carefully at the directory and how to make it user-friendly. So, I think that this is such a promising program. You've done some great things, but you're not tooting your horn enough. And again, if budget cuts come in that reduce what we have available, why is this important? I think you're at a point with 10 years behind you to do at least a a 2-page flyer or a 3-page, summary of all the wonderful things from Employment First. And then I think you could take or keep more exciting data on what's happened in the Employment First program. And then my last comment is you've returned funds, and so it's not clear if you need an increase in the budget. But again, I'm going to leave that to the staff. I'm not interested in picking at details like that.
Do you have any of your webinars recorded? We'd love to see one if.
That's not on. A lot of the webinars, they're not all things that we've created. We are sharing resources that exist in the community. So we're not trying to reinvent the wheel with all of it. There's a lot of great opportunities that we kind of push out to the businesses. I'm failing to think of an example off the top of my head at this moment. But we can certainly get you that information. Speaking to the number of people that are hired, I think one piece of this program that has been challenging the whole time is that we don't necessarily know if a business has hired somebody. We certainly do if it's somebody who's worked with one of our organizations, and that is information that we are definitely reporting. We do know that sometimes they will tell us. We actually, Ashley, who's our LEAP facilitator, she got a call from a business recently, and she was like, "Oh my God, I think that was the first time that a business has just called me up and told me that they hired somebody." And then kind of speaking to the impact of the program over time, I'm not exactly sure how to measure this, but I just like in the 9 or 10 years that I've been in this role and seen what community employment looks like for people with disabilities overall, it just seems like a completely different landscape. I think businesses are a lot more willing to have a conversation with us. It doesn't feel like a very foreign idea. And we're seeing younger people kind of come to us and say, hey, like, of course I want to get a job. Like it feels much more the expectation rather than the exception. I think that LEAP has had an impact on that just because it has been in the community, and the number of people that we have trained who've just heard that information, they may leave and go on to other jobs. And even if that employer isn't necessarily trained, they've now heard that message. And the more message that we can get out there, I think it really does have an impact over time. Again, I'm not sure how to measure that and tell you precisely. I will say in terms of the length of time that people are employed on the job, I mean, that's something that we keep track of. And so we report it in our customized employment application. I'm not sure how you guys keep track of it. Longitudinal data is a thing that we've actually found is pretty tricky to manage. But that is, I think we have a pretty good system at this point. So it would have been harder when we were certainly a younger organization, but we can, on our end of things, we can certainly get you that information too.
I think that this is it is important to toot your own horn, talk about the businesses. And, I was just thinking about is well, why not look at the economic impact of getting employment, for this population versus none? And I bet you it's going to show that there's actually a benefit. And, and another thing, maybe it's just an idea for an organization is why not also give some sort of, I don't know, recognition of businesses that are engaging in that. I think that that's, an important thing to just say, this is a business who's open, this is a business who's hiring. But, I think getting some of that past data, maybe going back to some of the places that you've trained and asking them, how has this impacted you? I think that'll be very powerful. I mean, not maybe for the funding issue, but I think, in terms of when you're talking to other businesses and saying that, this isn't going to be a money pit for you. This is actually a tremendous value. It's also a tremendous service to your community, and that we're kind of really improving lives around here. So I think that's important. The non-quantifiables,
Anything else? All right. Thank you very much.
think I'm staying up here.
Okay, next up is community, oh yeah, stay
I'll
there,
just stay.
Becca. Self-determination support, and that is Anne, and she is not here, so we'll let Kim take up first.
Okay, so this program is for self-determination. So they do things like providing or supporting folks to get education and leadership and community building opportunities. And they are requesting $228,000. And one of the, is this the one, let me check my notes. So one of the, well, I guess I'd like to get your reflections on some of the great activities you do. But one thing that I really love, which I think is a continuation from last year or last time, was this idea of the human rights groups and their participation, kind of the self-monitoring essentially on their understanding of their rights and civic engagement, and also like participating in community activities. Or and I just wanted to clarify that particular goal. Is it they're participating in like a public meeting of some sort? If you can talk a little bit about that.
Yeah, for sure. So there's a range of things. That group was a big part of the folks who've come in, spoken to you all every fall. I think last year we had kind of an additional person who joined us who isn't typically part of that group but has since joined. We've also given a lot of presentations to university classes. I mean, that has been a very, the group really loves doing that. And so we've had some good connections with people there. There's also just like when advocacy opportunities come up, we always present those to the group and give people a choice, like, is this something you would like to do? And so sometimes those are things that we plan, and sometimes they are things that just kind of happen. Like we had a number of years ago, we worked on creating like a healthcare guide to help sort of people be a better advocate in their own sort of healthcare interactions. And, you know, we'd presented on that in a number of places. We had an organization up in sort of Northern Illinois reach out to us and say like, hey, can you present this to our self-advocates? And so we were able to offer that as a webinar earlier this fall and kind of circle back to some of those things. So yeah.
Yeah, I'm sorry I had to take a little personal break. I don't have any particular questions. I had a little note here that I wrote on the bottom of something about sign-on and retention bonuses. Is that?
It's a separate application.
I got it on the wrong place again.
Oh.
I don't think you did make a mistake, Anne. That is something that Chris and I put into the financial analysis for each, because the agency was careful to explain that this budget doesn't include those retention bonuses, that's a different contract.
All right.
So you're right. I'm sorry.
That was in the big thing that I looked at quite some time ago. Okay. All right. Thank you.
Are there any other questions? Very good. Thank you, Becca. Moving on to, where are we? Community First. DSC.
Okay. So this proposal ensures access to community activities and the good things in life, as the application said, that everyone should enjoy: social, recreation, leisure, civic engagement, volunteering, and peer interaction opportunities. So, you know, an ongoing proposal with responsiveness. It's offered where it's needed, community formal and informal sites. Range of services are individually guided. And the outcomes are, I think, pretty traditional outcomes. 80% are satisfied with their chosen activities. It's important to be satisfied or you're not going to sign up again. And 5 new groups will be developed each year, which I think is important, that it's not static, it's always evolving. But you know, it is an expensive program at $990,000, and I'm not questioning the validity of the expenses, but I wish that there was just, and maybe again for future applications, a bit more detail, because I think you're not providing some of the depth and detail that might protect you in the future in terms of budget cuts. And I really hate to go about this because I've never been at a proposal review or discussion where I've had to worry about the future. But I think
now we do.
I think it's a reality. So I think satisfaction's, you know, it's definitely important, but I would love to know what are the specific numbers that are served each year in total. I'm not asking you to take more data, but I suspect you already have that data. So
We actually collect a lot of the data that you're looking for, and it's in those performance outcome reports that the agencies provide at the end of the year. So I think that there's a way for us to
maybe pull from that.
Yeah, I think that I have to create a technical opportunity for agencies to copy and paste.
Yeah,
because I think what you're looking for is
and I
they've
didn't
got
go
it.
back and look because, but it, you know, it was very clear to me that you served many more than 52 treatment plan clients, and that and I thought, you know, in addition to satisfaction, I just want to know the number of people who are benefiting, and so if we can pull it out of the annual outcomes,
Could be easy.
yeah, that would be great. And then I also just wanted to know, well, this is an interesting program. I'd love to have seen last year's schedule and participation numbers. Again, maybe that's in the final outcome, because I think it's probably more creative than it appears in the proposal. And that's not a dig at all. It's just that you were, you know, needing to say, we do a variety of things for our clients, and we ensure that there are new things that come up every year. I'd also like to know about the average number of groups per session. So you have these 3 times a year, which is great because people's interests change, and time of year may change interests too. So I almost wanted to see, you know, examples of groups offered, and to what extent are similar groups offered every triad, or do they change? Again, these are some of my curiosity questions that don't impact my recommendation for funding. It's just other things that I think would really make the program even more interesting, given the money involved. And then what is the staffing support for groups that are offered 3 times a year? Is it one staff for each group, or is it sometimes that individuals need individual support, so you may have several staff associated with a group?
I can answer that.
Okay.
Yeah, so typically we do have one staff for about 6 participants in a group, and so that's kind of the ratio that we try to stand by. Typically, we don't have anything smaller than 1 to 4 or 5. So, and the other thing that you brought up was about, you know, the amount of different opportunities. Typically, every trimester, we have 35 to 40 different things people can choose from.
That's great.
So
That wasn't
we're very
clear.
proud of that, and all of the kind of the dynamic things that are offered every session.
Okay. And then I did get a little confused when I was looking at this proposal, because I had also read the individual and family support proposal, which was the respite and advocacy issues, because both of the proposals talk about working with the CU Parks Department and the YMCA as potential, or fitness clubs as potential ways of providing support to individuals. And just because the YMCA came up twice, and the CU Champaign-Urbana Parks Districts, which is a great resource, overlaps also sometimes with fitness centers. I just wondered, how much does the program access activities or classes from those three partners, the park districts and the YMCA? And is there a cost to that, or is the cost more taking your groups to some of the activities that are available there? So they're partners clearly, but more information would be helpful too.
To speak specifically to the IFS part, since that's my program,
Yeah.
those YMCA or park district passes or activities that we do there, that is all funded through DDB through the specific assistance portion of that grant. So that is, you know, if a family says, my child could really benefit from this activity at the park district, or we really could utilize a YMCA pass because for sensory needs, swimming is really important to them. That's what that program is allotting for. For this program, it's groups. So there are groups of people that are going during the week to utilize the YMCA or the Leonard Center or that sort of thing. And those passes are purchased at a reduced rate, and it's utilized, again, one staff, 5 people every day in the evenings with our group homes. Like, it's not tied to a specific individual. It's just anyone from DSC with support can help to that. And Laura or AJ can share more if they want.
Okay.
DSC has purchased passes with the Champaign Park District, Urbana Park District, and the YMCA, as Kelly said, for a group of people. So that allows 1 staff member and 5 individuals to participate in those fitness activities at those centers. And it's not person specific. So it's groups every single day, multiple times a day. So our Clark Road crew accesses it, our Bradley crew accesses it, our Urbana crews access our groups. So they are used by, you know, hundreds of people throughout the week. So it's a very cost-effective and beneficial way to get groups of people involved in fitness activities. I also wanted to comment, Susan, on one of your questions about how many people benefit. While the 52 people funded through DDB participated in group activities, you'll see that the NTPCs, those are state-funded people who accompany DDB-funded folks in the community. And so last year, first quarter, it looks like 116 people who were state-funded also joined these different groups. So it's benefiting a lot of people.
And I think that's so important to know. And I just, in a cursory reading of the proposal, couldn't pull some of that out. But I love the idea that Lynn has, that somehow if we could tie the proposals with some of the main outcome data from the end of the year reports. You know, I don't mind reading another 10 minutes when it answers some of these really pertinent questions about, okay, it's 990,000. It's one of the more expensive programs, but how many people is it serving, and how diversified are the services it's providing? And it's sounding like it's serving a lot of people with some really unique and interesting and variable activities that they wouldn't be able to access otherwise in a very cost-effective way. So those are my questions.
Okay, well, I have a couple too. It is community first, and you talk in the proposal about it being community focused. So talk a little bit about how these groups, which I assume the group meetings most of the time are at DSC facilities, right? No?
So whenever I brought up that number, that 35 to 40 different opportunities, participants arrive at our facilities and then quickly we depart, and most of the entire day is spent in the community. And a good example of that is the role playing fan club group, where people who are interested in learning how to play Dungeons and Dragons, we don't just hang out and do that at DSC. We go and we have a community partner at Enchantment Alley in Urbana, and you know, with other people, we're able to access their tabletop gaming facilities to do that instruction. You know, another good example would be to you know, anytime it's the nice weather, we had a forest preserve group, and we went to every single forest preserve in Champaign County. So we're very much out in the community for most of the person's time at DSC for that day.
So as a group with, you know, 4 or 5 people
Yes,
at a time.
correct.
Okay. All right. Well, I don't have any questions other than that. Anybody else? Thank you very much. Moving on to connections, same people essentially, right? And connections was Kim.
Okay, so this is Connections, which is an community-based arts program essentially, and facility. So the grant is for $122,000, which is an increase of 6%. It includes funding for the space rental at the Crow, which is on University and Lake First, programming, events related to art or creative activities. It's an embedded, a program that's embedded in the community, and there's several ways that artists, community artists are collaborating with DSC members to deliver or to engage in activities. Actually, if you could clarify that collaboration with the artists, because I read it as community artists are collaborating with a couple DSC folks to actually teach classes. Did I read that correctly?
Yes, so we do have community partners that we team up with for instruction. A good example is CU Create, which she comes in on Fridays and leads instruction. We also have a really good relationship with several different art educators in the community who, when they're on their opposite, when they're available, will come in and one has done a watercolor instruction. We've got 3D things that they come in and support people with. So yes, we do have some staff that do a lot of the instruction within the program, but we do also have the partnerships with some of those other artists in the community coming in and doing some of the instruction as well.
Who is the secondary on this?
Me.
Okay.
Okay. So yeah, this is a great program. The Crow's a wonderful place, and I really appreciate the visual arts component. But I've always had this question. It may not having to do with this grant, but what happened to the prompting theater doesn't exist anymore. Where's the music aspect of creativity? Could somebody do a community chorus, a band, rhythm instruments? I just, I'm looking at what DSC is doing, and I just don't see anything other than, the visual arts are great, but where are the other ones?
So I'd love to respond to that.
As a former music teacher, I can, yeah.
So we do have some theater happening right now. On Thursdays, we have a local, we have a pretty good relationship with the station theater and some people there. So we've our theater group that primarily does just kind of introductory things in theater has done some set work with the station theater this trimester. We also have one of our staff is a musician, a touring musician, just getting back actually from Arkansas on a tour. But he does in the past he's done make your own instruments. So we have that 2D art or 3D art component and the performance piece. We have a jam session. So we do have some performance aspects within this program.
So that's part of this connections programs. Yeah, I didn't see that. And I guess the art part of it has been so beautifully out in the community with artists selling their productions and showing up at Ebert Fest and having the events at the Crow being part of Boneyard Arts Festival, but I haven't seen anything from DSC for theater or music. So advertising, community awareness. Because I used to love to go to those theater productions. They were great, and I would definitely support music performances.
Any questions from the group? I have just one comment, and I would, as a board member, I would like to be able to give you more money to do more individualized experiences for people. So if you have somebody who would be interested in doing a, volunteering for an art gallery or, something like that, where they're connecting to the real world in their quest to be an artist. I think that those kinds of things are things that we would support in a enthusiastic way. So for future reference, think about that. Thank you very much. All right, we're moving right through these. Got
How's everybody
two more. All right, so community life short-term assistance, we have no review on that, right? So we're going to community choices, staff recruitment and retention, and that would be Neil.
Okay. Hey. So I think this is pretty self-explanatory in that this proposal is for new recruits, retention, salaries. So the it's funny. The amount is like one of the less amounts requested. It's 48,000. But I do note that it is a 41% increase from the previous year. So I was just a little bit curious about that, and yeah.
Yeah, absolutely. So it is an increase. We've kind of added to the program this year. So Community Choices, we have 17 staff. 3 of them are part-time, and very little like administrative staff. So it's me and a portion of Hannah's job. And one of the things as we continue to grow, being able to address a couple things. So one is just some of the administrative tasks and sort of projects that that sometimes we just don't have the capacity to give as much attention as we would like. The other piece is because, again, we're a smaller organization, the opportunities for staff to grow are more limited. When you have a large organization, there's always a lot of different sort of avenues that a person can take as they sort of expand their career. And so what we added to the program this year was sort of something that we could try to address both of those things. I am a firm believer that you should not ask people to do more work unless you're going to pay them for it. And so while I think we have really amazing staff with a really wide range of skills and a lot of commitment to the organization, personally, I have been unwilling to sort of ask them to do additional work without the funding to give them some additional money. And so this sort of that extra $14,000 would be to fund like leadership projects or leadership development projects that would sort of address some of those administrative things that we maybe haven't been able to address as fully, but also to give staff some opportunity to build their skills, do something that's slightly outside of their normal day-to-day tasks, and sort of build their own sort of leadership capacity. If they choose to then apply that as the organization grows, wonderful. And if not, and they move on to a different pathway in their career, I mean, obviously we want people to stay, but we also want people to be able to expand the skills. And I have been very fortunate to have had supervisors who gave me those opportunities, some of which were from DSC. And I just wanted to be able to do that for my current staff and also address some of the things that I think we could give more energy to.
Sorry, what were some of the things like administratively, like you guys are?
Yeah, absolutely. So one of the sort of really practical ones was just sort of managing our sort of formal partnerships. So these are forms that we update, sort of reaching out to area organizations to sort of check in at least once a year and sign those sort of like MOUs essentially. It's kind of one of those administrative things. We have great relationships with a lot of those other organizations, but sometimes like when you're going through the list of things to do, that one often gets to the bottom. And so that's something that one of my staff could absolutely take on. So that's one example. Another one is we would really like to develop a CLC committee that is made up of our staff and our members to sort of help to both design the CLC plan for the upcoming year, track our progress on the current year, and to put it into a format that's a little bit more accessible to our members. So you've seen them, they're long documents. And so we'd like to spend some time sort of putting that into perhaps a more visual format. And again, just something that kind of doesn't sort of live with anybody else's job description, except for maybe mine and Hannah's. But we do have a lot of staff who are very committed to those things, that are excited about doing that work, and this would be a way to compensate them for that. We'd also like to be able to provide some new staff mentoring for new people who come into the field. So be able to match them up with a staff who's been there for a longer period of time to sort of help build some of that community within our staff. One of the things that can be challenging about our structure being very community-based is that sometimes there's just not a lot of people around. And so our newer staff tend to be more in the office, and like, I love it when people come and ask me questions, but making sure that they have sort of another touchstone within the organization that's like really devoted to like helping them understand how things work, answering questions, troubleshooting. So that's another one that we're hoping to include. And then like some others, just like we don't have like a database system. We run off of a Google Workspace platform. And so, you know, if we have a staff person who's like interested in that type of stuff, just the time that it takes to figure out like what those technological solutions might be, and then think about a plan for implementing them, is another thing we're hoping that this could help to address.
Yeah. I mean, with some of those things, like, you know, with the mentorship, that could probably happen with very minimal cost, if anything. But then like the database stuff, that seems like so that could be like very useful, where the money could go.
Yeah.
Other questions?
Just that this is a very exciting program. It's fun. Well, all of them are exciting. I don't need to say that. Sorry. Just I noted the leadership. So thank you for explaining that. That's really great. I noted the outcomes are great in terms of like measuring, you want to fill positions within 60 days and give retention bonuses for those who are there. Or keep your retention rate, I guess, is greater than 4 years. Sorry, misspoke there. And then I put pay for PD with conferences. So like you're paying people to go to conferences. Is that right? Or is that a potential opportunity? I wrote that down, but maybe I'm wrong.
Yeah. So
which is great.
Within this application, we have asked for funding to subscribe to an online learning system, Open Futures Learning, who provides like really awesome trainings. And so we've been using those sort of internally, at least for that part of your question. Internally, we've been using those both for new staff, and then we all participate in one of the trainings each quarter and have a great discussion. We have people who are very new to the field and people who've been doing it for 20 years. And we've found that it offers like great conversation for everybody. I learned stuff. It also, within all of our applications, we do have money allotted for professional development and training, and that helps to pay for people if they want to go to conferences and that things as well. So that's part of it. It's not specifically part of this application's budget.
Got it. Because this is where I picked up on it, and I was like, you know, it's important for people professionally to be able to connect with other professionals. So thank you for doing that.
Yeah. Out of curiosity, what is your retention rate?
So I think it's in the application, and no, it's fine. So I think we have a pretty good retention rate of like over 4 years. We have had some turnover in the last year. It's mostly, you know, people going on to work in other like fields and sort of, you know, expanding their career in ways that we weren't able to offer as a younger organization. Part of the reason that we kind of developed some of this. I think our average length of time is like around 4 years. We have some staff that have been there over 12, and quite a few that have been in there in that sort of middle range.
Yeah, that's
Yeah.
good.
Anything else? All right, then. Thank you very much, Becca. You're off the hook for the rest of the day. But not DSC. They're back again for their last one, Family Development. And Susan, you are the lead on that.
You. Okay. So this is a program that's also funded by the Mental Health Board, which means that some of the caveats that we've brought up with other proposals don't apply because it's very hard for a newborn infant to already be PUNS eligible. And since you're serving children really birth to 5, this is the critical point of development where you're beginning to determine what are the risks, what are the developmental delays, what are the diagnoses. And I will say that 32 years ago, DSC was the only place I could go when my son was born to have some early intervention because early intervention was still so new in 1993. We had insurance, so we were eventually referred on to clinics because we could pay for it, and DSC was serving those who could not pay for it. So it makes a great deal of sense to me that you're still in this business. You've been in it for generations, and it fills the gap that would not be filled by local entities. So I think that's really important. I had a couple of questions. This is a continuing program that's very good. It's been it's in high need. I was curious about the MOUs with the other 12 agencies and how those help to clarify the role of DSC's screening without any duplication of children and families. And I'm asking this because there are several other entities also charged with screening, like the school districts for 3 to 5, the Child Family Connections Office, birth to 3. And I'm sure that alone, none of them could do it all. So it's got to be the fact that you've come together and are collaborating to some extent to make sure that every eligible child or family is seen. But how do you manage to avoid stepping on each other's toes?
So I think you answered your own question. The memorandum of understanding that, kind of connects all of the children's services that are in the community is a really solid group. There's a local interagency council. There's a birth to 5. There's the home visiting consortium. There's a lot of meetings that have representation from all of the entities that meet regularly.
Okay.
It's actually a really cohesive process, I think, for our community, and shared. They do, I think, once a month, there's a joint play group that happens, and so people can come and kind of choose. Our screener, the person that does all of our screenings, it's phone call referrals, it's referrals to each other. There's some that might only do rural or might only do, preschool readiness. I mean, there's kind of a caveat. There's a little bit of differences to what some of the screenings and who's responsible for, if that makes some sense.
It does. It's a very complex system because of the number of players. And so it's been a while since I retired, and so I've lost track. But again, I just, it's an expensive proposal, 700,000. I think that without DSC's involvement, there would be an enormous gap. And I'm really heartened to know how much the MOUs with the other agencies make a difference, and that these interagency councils continue and go on. I think that the fact that you serve 655 children is also pretty amazing. So I don't really have very many questions other than concerns over what will happen in the future as the Department of Education's being split up and the funding that's associated with IDEA, whether it's early intervention, preschool, is uncertain. And I don't know how much the state is supporting the infrastructure, but I just, think it's a really important program that's supported by both boards. And I originally started off by thinking, well, how are all of these children eligible? And then fortunately Lynn said, oh, it's mental health as well as DDB. So
the social emotional piece of it is significant.
Yeah.
And I think, the Children Family Connections, which is kind of the children's version of ISC, is wildly overloaded. And there's also families that don't have CFCs assigned to them or, because of turnover and stuff. And so, that's always the first place. Any referral goes directly to CFC, and if they decline, then insurance is also accessed when that's available, and then it falls to CCDDB or MHB. So it's definitely a frugal program, even though it's expensive. It's similar to, I think it might have been Anne that mentioned it earlier with the clinical. It's, they're clinicians, they're developmental therapy, OT, PT, speech. So there's an expense associated with that that's a little higher than some of the other services, but much needed. And if the funding is threatened, less kids get service. I mean, there's no way around that. I think everybody seems to understand that costs, are lower when you do something at the front end, but the changes and the threats that are happening at the national level are worrisome.
No, Kim,
Did you have anything?
I just want to clarify that this program provides services that are not billable anywhere else.
Correct.
Just to clarify.
Yes. Okay. It's services that the state or insurance will not cover.
my vignette.
Turn it on. My personal experience, which was decades ago, having a young child with disabilities, was that bringing people together in those play groups so parents could meet each other is such an important piece of this. Do you ever have an opportunity to bring parents together without their children so that they can actually have those discussions?
Yes. So I'm glad you mentioned that, because the play groups they have also been a Band-Aid for families that are waiting. The speech therapy especially is, there's significant waiting lists for therapies. So some of our speech therapists will do play groups at least to connect families and to do some group activities while waiting for that one-on-one support. But yet the play groups sometimes are with the family, the parent present, and sometimes not, so that that community can happen.
Oh, so the parents have their own play group.
Kind of, sort of, yes. Adult conversation, yeah.
There's also an effort, and this is again, the DD money that the Mental Health Board spends goes into these early childhood programs. And another one is through Head Start, and they do parent get-togethers, and I don't know if they've accomplished it, but they were trying to go where parents are, like more into community locations. So that might be kind of what you're looking for, but it's part of the home visiting consortium.
Yeah, I think that support from other family members, that are not your family members, is really, really critical. Anytime you can encourage that.
And I think the last thing is that we did with a former director had kind of got it started a little bit, and we're in the process of kind of resurrecting it, is having a parent advisory group. And we're kind of looking at different ways that we might implement that, whether that's, a group of parents that when we want some input on a topic that we would kind of, go to them, or if it would be different groups that would kind of help with different, social or parent request information or something like that. So I think that that'll be another kind of outreach effort that we'll be able to do. And before we're done, I just wanted to make sure that our new director didn't have anything that she wanted to add that we didn't cover well.
I think I've just been mimicking what you've been saying. So yeah, nodding in agreement.
Any other questions? All right, then. Thank you very much. Thank you, everybody, for your input today.
Time for 2 items.
There could actually be a synergy between all these groups, right? So why not have like an art and music event in which people are also auctioning some stuff that would also raise funds, that the parents would meet there, and that you could also staff it with people with developmental disabilities. There you go. Combining.
Dr. Sharma, I think you could probably get yourself invited to a Birth to 5 council meeting or a home visiting consortium meeting. Those are collaborations that our community should be really proud of. They've won
Yeah.
national awards for collaborating in this way. And we know the systems are all inadequate to meet needs, but this effort has really set them apart. So I know you could get invited to share
Yeah.
ideas.
No,
Or to be in charge, you know? Like you need one more thing.
right.
Okay, let's move forward and talk about the, oh gosh, the minutes. We haven't approved the minutes yet.
We have an error.
Okay, so that'll be an easy one.
The notes that we have an error.
Oh, you have an error in it? Okay.
Go ahead and talk
We need a motion first and then.
The
Yeah,
motion
and then we can
to
make corrections.
approve the minutes.
Thank you. And what's the correction that we need?
We missed a participant, just in others present, we need to add someone, it's Danielle Matthews.
Ah.
But we have not heard of any other errors, but there could be.
Well, good that we fixed that. So do we need a revised motion then? I did too, but we still should do it publicly. Go ahead, Kim.
Motion to approve the minutes with the suggested amendment of adding Ms. Matthews to the others present.
And you agree with that, Ann? Okay. Any other discussion? All those in favor say aye.
Aye.
Any opposed? Okay, motion carries. Next on the agenda is vendor invoice lists.
I move to approve the vendor invoice list.
Thank you.
Second.
Any discussion on that? All those in favor say aye.
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 This is getting tired, apparently. That's done. Response to emerging threats. Do we want to have a discussion on that today, or we had enough discussion?
I did just add a couple things like ACL. So thank you for putting this in. The ACL does tremendous work, so many projects and so many departments. I mean, it's just a travesty and it could really have very significant impact on the folks we serve. I'll just also add that the House passed the budget resolution, which is supposed to find $880 billion in savings. So they have a framework. So I know there's just been tremendous advocacy to try and save what we can for Medicaid and us also, what is it, the SNAP benefits, I think is also, right? So just continued advocacy. The ARC of the US has, and I can send this to you, Elaine, but the ARC of the US has a Q&A section on what the budget resolution is and answers about that and how it can be impacted, how it will impact services. It also has plain language. I don't think easy read, but plain language information about this issue. So I think spreading that information to community members, those who have IDD or not.
You can't just leave a baby and disappear. I'm sorry, you know.
You were entertaining her, Timon. All I did was
Somebody's mic is on.
It sounded like you, Lynn. I was looking down. Anyway, so I'll just also note that finally, I think institutions are kind of banding together because we will not be able to individually fight that. So that might be something we need to be thinking about. Like the ACL thing funds state councils of DD. I mean, like, that could be gone. It's just unbelievable.
Centers for Independent Living also are part of that. So it's a time for advocacy, for sure. And I actually, in my whole life, I've never been to a demonstration. I went last month. Yes, I did. And I will be going to more and bringing more people because it's really important. And making posters, that's right. Yeah, it's crazy out there. So thank you for bringing that up as a discussion item way back when, you know?
Well, thank you to staff for posting this article. It's really helpful.
Mm-hmm.
I just want to say, I just really love that we include this part of our board meetings. I think it's a very important thing. I think it's very innovative. It's something that, I mean, the the health board, everybody. This is a big topic, so I'm really happy for that space, and I think the concern and like a theme that I was kept bringing up is about like resiliency. How do we sustain? Because we don't know what's going to happen, and so that's where it comes down to, I think, having more conversations amongst agencies of how potentially consolidation of services so that we can, united we stand, divided we fall. So.
Yeah. Okay.
Oh, real quick, just Lynn, I know the county board was going to maybe potentially address some of these issues. Is there any update about that? Or is Leah?
They had asked me to present the results of our survey, but then they scheduled something else for that night, which was fine with me. And our survey results were pretty much like, I think it was clear that we just need to wait probably 6 more months and then ask again, because no one knows what's going on. And yesterday, as recently as yesterday, I told a group, it's very hard to speak to any federal changes because they change every day. But here's one thing I'm sure of. And guess what happened an hour later? It was changed. So I'm learning, like, don't say anything because it's not true 10 minutes later. So I think this is too rapidly moving for us to be able to get an idea from the agencies. Plus, it's very possible that rather than fill out our survey, they're going to be preoccupied with scrambling, whether it's reduction in force or changing the service structure or eligibility structure. So that answering our questions might be like secondary, but we will do it. We felt the survey was good. It was just too early. And the county's discussion last night was on budget forecast, and there's just one detail I can get back to you. Much earlier, you talked about 2-year contracting and the question, the barrier being uncertainty about the following year. I did get budget estimates for the next 2 years. So there's more potential to do 2-year contracting than there has been before, but we would want to be very intentional, and that's a conversation for later, but just to loop back. So anyway, yeah, we really don't know enough yet about impact other than scaring everybody. That certainly has an immediate impact. Yeah.
Yeah. Okay. Moving on.
To that point, I totally agree. And I mean, it's just this whole flip-flopping left and right, it's just throwing disruptions. I mean, think about also businesses as well, like, do you plan for tariffs or you don't, but I do think it is an important conversation that we got to kind of think of a plan B, a sustainable plan B going forward.
And maybe even a plan C.
I'm going to just jump in and be a troublemaker. And I did this at our National Association of Counties. 200 people in the room, and we have a new administration official, newly appointed administration official, telling us that we need to be more creative with Medicaid, more innovative, more resilient. And I just blurted out, that's what we're always doing. And everyone was very silent, like they couldn't breathe. But in the hallway, a whole lot of providers and other government officials said, thank you for saying that. This was such, like, there is really only so much creativity that can get you. I mean, we all know how personal budgets are. It's not any different. So.
Absolutely. Yeah.
All right. Next thing on the agenda, evaluation capacity building project update. Do we have somebody to do?
Morning.
Good morning. It was a long wait for you.
I was trading places with Jacinda, so we had back and forth logging on to make sure that we were covered. So I will keep this quick for you all. We are working on the annual report. The contract for the next term is in process, and we are almost ready to put out a 1-page flow diagram that breaks down quantitative, qualitative, and mixed methods approaches to evaluation and ways to think about choosing which one and what steps might be taken. And that's been revised a couple times with help from our team as well as our working group. And we do officially have someone from a DD agency now on that working group, and so we're thrilled about that. I think that's about it.
Any questions? All right. Thank you very much. We appreciate your continued effort.
Thank
So
you.
just real quick, like this is a wonderful investment that the county is making for supporting this work. Is the mental health board also funding it?
Mm-hmm.
I mean, I just think like providing this information publicly while we are supporting agencies is wonderful because they're providing such great work. But then, I mean, this is like, we should be advertising that Champaign. Yeah, please do. Yeah.
Meeting going on for longer and longer. So you fund this and the mental health board funds this, and it is a longstanding program. This is a newer provider entering the third year of this contract. But we were at a local funders group meeting recently where a different funder was bragging about the materials that they've developed and made available publicly that this group has developed. You know, and that made me happy because I don't want us to be only paying for supports that apply to organizations that are already funded. I think it is important to use this money for the public good. And they did that, and they posted it on their very easy to navigate website, and another funder found it and was bragging about it. I was like, this is a dream come true, right? So.
Yeah.
Yeah, it's been a pleasure to work on as well as get to know, it's my favorite part of this work is getting to know the people at the agencies because it's just, when we're working with data and, research and evaluation methods, the fun part is getting to see, the people doing the direct support work and really making an impact. So, we went to Boneyard and saw and purchased art and soaps and candles from that. And it's been a great experience, and we're really grateful to have this opportunity. So we hope that all of the resources are helpful to a lot of people, and we are open to feedback along the way.
Thank you very much.
Thank you.
Okay, successes and other agency information. Anybody have anything else they want to talk about today? Oh, Patty, yeah, of course. I know.
Very briefly, I thought you'd want to hear about this. But last Wednesday, there were 8 advocates that went to Springfield for the They Deserve More Action Day and met with Senator Faraci and Senator Rose that day, and also kind of got to go to the Capitol and experience. There were over 200 advocates that showed up, which is the biggest that they've ever had. So they said that they would reserve a bigger space next year. And it was a great experience. And just to hear the advocates kind of talking about what the issues are and the commitment that you guys have helped us build with having a dedicated position for some of the advocacy is really happening and really working. And, Senator Rose gets it. And Paul Faraci does too, but the conversation that we had with Senator Rose was kind of understanding the difference between Chicago and downstate and everywhere else, that 150% that we're trying to get to for the DSP wages, Chicago has that and no one else does. And the bigger voice is the bigger part of the state, right? So he really does say that he's going to be speaking with the governor, and he wants to meet with the advocates again here so that he has more time to kind of pay attention to the messaging and let them be a part of that. And then the other thing too is that Senator Faraci said that he would be co-sponsoring the bill after having met with them. So it felt like really effective time and well spent in Springfield, and just wanted to share that. So
yeah, that's awesome. Yeah, that's great. Love the advocacy. Anybody else? Nope. Everybody wants to go away. Okay. All right. County board person is not here, not online. Okay. All right then. Mental health board. You have an ink blotch or something on your.
So the mental health board is meeting tonight. They have to have 2 sessions to get it done. They're going to be so jealous that you got everything done today. But yeah, they've got a lot to look at tonight. And that's all they're doing tonight. And then their meeting is April 30th.
Okay, so we're down to board announcements and input. We should cancel April 30th. Yeah. Do we need a motion and a second to do that? Okay, we'll just do it. Okay, very good. And
So
that's,
I just want to say real quick, thank you, staff. Thank you, thank you, thank you. These summaries were just amazing
They
and
were.
made the job, as usual, so much easier. So thank you for your hard work.
very
And I
helpful.
appreciated having the full thing available printed out so that I had plenty of time to look at it. That was also helpful. Thank you.
Yeah.
Because I find reading things online to be tricky for
Well,
me.
and it's hard to take notes. You can do it, but it's hard. Anybody else? Okay, very good. Thank you. I guess we are adjourned. Thank you all for coming and sticking through this very long meeting. We appreciate it. And it is not even yet.
You feel like you're really part of the group now.
Yeah, no, it feels good, you know.
Well, it's been good having you on Zoom, and I understand that you have to do that, but this is this meeting and then the next meeting where we vote on these things. This is
Yeah, these
the
are
meat.
exactly. So then the next meeting would be like May, I think.
May. Yeah.
Yeah. I have to work this
Hopefully
schedule.
won't be as long because we've already had the discussion.
You know, I'm just like, I hate the idea of being pressured. I think it's just like, I'm just gonna clear out to like 12. So
Yeah.
I think they screwed up my next month, but
I
like,
don't, well, May is the time that we're voting.
yeah. So that's,
But we probably can get it done in a couple of hours.
yeah.
Yeah. But this, having this discussion and having the agency people here for you
Oh, yeah.
to meet people, because I know these people.
I know, exactly.
And, you know, what you said about collaboration, they are, this community is such an incredible model.
Yeah. And I think that's so important. And I think,
And there are people at Carl that are working with the agency too.
oh, that's good. Yeah. I mean, I heard there were some issues with Carl and stuff like that.
The big issue is that Carl leadership decided that they wanted to try not to pay property tax as part of their business plan. And that was a decision that was taken about 10 years ago, or more than 10 years ago. And they've also gotten into the real estate business big time.
It's true. They've been buying up a lot of places and like,
So that was where I parted ways with the Carl leadership because, you know, Carl has been an important part of this community.
yeah, it's been huge. Yeah.
And the decision was taken by senior leadership with consultation with outside consultants that they should not pay taxes as part of their business, their business plan.
This is my issue with
like a
nonprofit
business
status with,
plan like
yeah,
that too.
correct.
Yeah.
Yeah. I'd like to not play. Yeah, that's the point is like, I do think there's a massive abuse with this nonprofit status with hospitals. And I mean, yeah, with the way Carl is, I'm like, come on, you really couldn't do this and actually like give back to the community that you're. There's like almost like some monopoly feel, like where it's like, well, we are the only pretty much game in town. I mean, there's always others.
Well, I think I have my own opinions. I think there was everybody's, I mean, Carl used to be a physician like, and it technically is.
Yeah.
But the people that a long time ago, wanted to more a corporate business model.